Treatment depends on the type and severity of the condition. The majority of the autoimmune diseases are chronic and there is no definitive cure. But symptoms can be alleviated and controlled with treatment. Overall, the aim of the various treatment methods is to lessen the presented symptoms for relief and manipulate the body's autoimmune response, while still preserving the ability of the patient to combat diseases that they may encounter. Traditional treatment options may include immunosuppressant drugs to weaken the overall immune response, such as non-steroidal anti-inflammatory drugs (NSAIDs) to reduce inflammation, glucocorticoids to reduce inflammation, disease-modifying anti-rheumatic drugs (DMARDs) to decrease the damaging tissue and organ effects of the inflammatory autoimmune response. Other standard treatment methods include vitamin or hormone supplements for what the body is lacking due to the disease, insulin, vitamin B12, thyroid hormone, etc. Blood transfusions if the disease is blood-related. Physical therapy if the disease impacts bones, joints, or muscles. Because these drugs aim to reduce the immune response against the body's own tissues. There are side effects of these traditional treatment methods, such as being more vulnerable to infections that can potentially be life-threatening. There are new advancements in medicine for the treatment of autoimmune diseases that are currently being researched, developed, and used today, especially when traditional treatment options fail. These methods aim to either block the activation of pathogenic cells in the body or alter the pathway that suppresses these cells naturally. The goal for these advancements is to have treatment options available that are less toxic to the patient and have more specific targets. Such options include monoclonal antibodies that can be used to block pro-inflammatory cytokines, antigen-specific immunotherapy which allows immune cells to specifically target the abnormal cells that cause autoimmune disease, co-stimulatory blockade that works to block the pathway that leads to the autoimmune response, regulatory T-cell therapy that utilizes this special type of T-cell to suppress the autoimmune response. Research. In both autoimmune and inflammatory diseases, the condition arises through aberrant reactions of the human adaptive or innate immune systems. In autoimmunity, the patient's immune system is activated against the body's own proteins. In chronic inflammatory diseases, neutrophils and other leukocytes are constitutively recruited by cytokines and chemokines, resulting in tissue damage. Mitigation of inflammation by activation of anti-inflammatory genes and the suppression of inflammatory genes in immune cells is a promising therapeutic approach. There is a body of evidence that once the production of autoantibodies has been initialized, autoantibodies have the capacity to maintain their own production. Stem cell transplantation is being studied and has shown promising results in certain cases. Altered glycan theory. According to this theory, the effector function of the immune response is mediated by the glycans polysaccharides displayed by the cells and humoral components of the immune system. Individuals with autoimmunity have alterations in their glycosylation profile such that a pro-inflammatory immune response is favored. It is further hypothesized that individual autoimmune diseases will have unique glycan signatures. Hygiene hypothesis. According to the hygiene hypothesis, high levels of cleanliness expose children to fewer antigens than in the past, causing their immune systems to become overactive and more likely to misidentify own tissues as foreign, resulting in autoimmune or allergic conditions such as asthma,